We do want to bring in now our chief health editor, Dr. Nandi. Doctor, before break, we were talking about hospital shortages. Do you think we could start seeing other hospital systems face the same problem, or are they already?
100%. I think that the problem that Beaumont's having, which is the combination of the increasing COVID case with the surge, with the lack of staffing, right? So this is it, not just the hospitals, but every healthcare facility this is happening. So absolutely, which goes to the point where please, if you can, get vaccinated. And if you're not vaccinated, take protection so that you can mask and you can social distance so you're not getting infected. We need to help our healthcare workers and our facilities to be able to handle this. If we don't, we're going to be in a catastrophic situation.
And the FDA, Doc, has released new data from Pfizer that suggests vaccine immunity can wane over time and that COVID-19 booster doses are not only safe but necessary. What can you tell us about this new data, and can Moderna recipients expect any data like this soon?
So Brian, the Pfizer's data from both the U.S. and Israel shows that it's COVID-19 vaccine, and it begins to wane, right? The protection begins to go down somewhere around 6 to 8 months. And the drug maker says that research suggests that a third shot given 6 months after the second dose can really restore your protection from the coronavirus to 95%. And so here's the thing, right? That's why people are requesting the FDA to approve third doses for everyone age 16 and up. Right now, only Americans who are immunocompromised can get a third dose. And that's because research has shown that people with immunocompromised systems, right, can have trouble building an optimal immune system to fight off the virus.
Careful to note that that information, that data is from Pfizer, but some research is supporting boosters while other research shows vaccines are working just fine. So experts are having disagreements. Do we know what the FDA stance is on this?
Yeah, you're very right. It's Pfizer's data that we talked about. The agency has not taken a stance, which makes sense because the Vaccine and Related Biological Products Advisory Committee, they're meeting this Friday, and that's the FDA's independent group of experts, and they'll dig into all the research, not just the one we talked about with Pfizer's, to determine, is it really necessary for all of us, all Americans, to get a third shot. They'll also look at safety as well. Having said that, the FDA did release a staff report. This report is to brief the advisory committee before they meet, and it mentions a few things that could indicate where the federal agency is thinking. Now, it said, quote, while observational studies can enable understanding of real world effectiveness, there are known and unknown biases that can affect their reliability. Also said, quote unquote, US-based studies of post-authorization effectiveness of Pfizer's vaccine may most accurately represent vaccine effectiveness in the US population. So in a nutshell, the FDA is acknowledging that observational studies, right, are not the same as clinical studies and that may have different outcome. And what happens in another country, for example, in Israel, may not be what's happening in America. So in my opinion, it's going to be a tough decision for them. And the decision on boosters is really up in the air. On one hand, you have Pfizer's data I talked about showing immunity goes down. On the other hand, you have a recently published paper by a group of scientists, really predominant scientists, that said that COVID vaccines still have strong protection against severe illness. So one thing is for sure, we have a virus, right, that's going to change. It's important for Americans and the world that we are prepared if the virus mutates into a more dangerous variant. And if we start seeing many vaccinated folks getting severely sick or dying due to waning immunity. So we have to just wait and see what they say, but also do our part. If you can get vaccinated, please do. If you're not, get protected.
Important point there. Dr. Nandi, as always, thank you for your expertise. We're truly grateful.
Thank you.
And if you do have a coronavirus question for the doctor, you can email him, Dr. Nandi, at askdrnandi.com, or send it to us on Facebook or Twitter.